Hello, I can see that there are a few people coming into our non-surgical facelift seminar. Welcome. I'm just going to make a little bit of small talk until we let all the participants in, but you're all very welcome. And I'm so pleased with how many people have expressed an interest and are attending. It's great to see you. Hi, Jane. So you're flowing in. Wow. Hello. I'll introduce myself in a minute, just waiting for Angela to finish inviting me in. Hello, Susan.
Lovely.
All of this is personal and confidential, so no other names will be used. It's just a bit of a welcome. Hello.
Hello.
Just mute yourself whilst we are doing the presentation, everyone. Otherwise, you'll run into it.
All right, okay.
Turn on mute for yourself, and that's it. And then in a minute, my colleague Angela is going to tell me when everybody is admitted into the Zoom room. You're all very welcome. Oh, my colleague Vicky. Hello, Vicky. Nice to see you again. We can't go on meeting like this. Just a few minutes now before we start. It's only 13:01, so Angela's going to give me the heads up on when we should have everybody in who's signed up. A lot of people interested in this, so it's going to be a real good use of 45 minutes or so on a Thursday afternoon.
Okay,
Are we ready to start? Yeah. So hello and thank you very much for giving us your time during this Thursday. My name is Maria Brennan Thorns, and I'm the owner of the Qutis Clinics group, and I'm an advanced nurse practitioner. My colleague Angela is on the other screen, and she is our senior nurse manager and business manager at the clinics. So, an advanced nurse practitioner is a nurse with a Master of Science degree, and I've got a prescribing qualification, and I've done some research within my own field, which is medical aesthetics. And I like to share that with you so that you feel reassured that we know what we're talking about. Qutis legacy is now about 25 years. So we've been running clinics like ours for 25 years. Our first clinic was in Tame in Oxfordshire, the second one in Witney in West Oxfordshire, and our latest one is in Hertfordshire, Pickett's End, quite close to Hemel Hempstead. So you're all very welcome. Now, what I'm going to do is run through a few slides, and Angela is going to move the slides on, and that will take us about 30-35 minutes, and there'll be plenty of time for private questions. And Angela, if you just want to say before we start how it works on Zoom.
So everyone's videos are turned off. Your names, unfortunately, because of the Zoom platform, it's a public sharing platform, and it's set up for meetings as opposed to private interactions such as this. So if you'd like your name to be confidential, you can select on your name, and you can just change the name to your initials or no name at all within your Zoom invite list. Otherwise, everyone's video is turned off and you're all muted. At the end of Maria's presentation, we will read out questions that are asked. I'll stop sharing the screen and I'll read out the questions that are asked, and we can then answer them taking turns.
Thanks, Angela. Okay, so at Qutis Clinics, and Qutis is a derivative of the Latin name for skin, cutis spelt with a C, like cuticle, but we played around with the spelling so that we could own the word mark. At Qutis Clinics, we have been injecting dermal fillers and Botox and doing heat and light treatments such as laser and intense pulse light for 25 years. And you can well imagine, can't you, that it's evolved over time. So we have called our non-surgical facelift, the Qutis non-surgical facelift, because it is something that treats the whole face. Years ago, when I started, people would come in and say, it's this that bothers me, or it's that bothers me. But now we're looking at the whole of the face and the neck as a global area to rejuvenate. So in particular, it treats the cheeks and the jawline, and it allows for combination treatments. So the Qutis non-surgical facelift, after you've had a consultation with us, you will be advised by one of our expert nurse practitioners, and we are 3, about exactly how we will use dermal fillers, Botox to help relax some of the lines that are expression lines, and how we will be able to use intense pulse light and heat to treat the whole of the skin surface. And like I said before, this allows a universal approach rather than a minuscule just concentrating on a line approach. And because I've been doing this for 25 years, I've seen it evolve. And I think that it's a much better way of giving a rejuvenated and total look that all matches. And the main thing, of course, that we are doing is we're dealing with the aging face. And as we age, we lose volume, and we lose volume in our cheek area and around our mouth, and then also underneath our eyes. And the nice thing is we really customize it to your own face, and we're good listeners. As nurses, we're good listeners. So we would not in any way wish to make anyone look false or not themselves. It's just a fresher version of themselves. Next slide, please. So this is a question that is good to cover in something like this forum, which is what we're frequently asked. What are dermal fillers? Well, dermal fillers are largely nowadays hyaluronic acid. And hyaluron is produced naturally in our bodies and in many, many mammalian creatures. It's mainly found in our skins and in our eyes. And for instance, it's a lubricating fluid found also in things like knee sockets. So this is taken, and its function when it's in the body is to retain water and to keep our joints and tissues lubricated. So the scientists that have created hyaluronic fillers have been very clever here, because what they've done is they have looked at what is found in nature, been able to reproduce this in a laboratory pharmaceutical type environment, and then over the years the many clinicians like myself and Angela and Paula Shurrock and other doctors and nurses within the aesthetics arena have designed treatments that are very cleverly placed and safely placed in the skin in order to help our skins age well, using something that is originally found in nature, hyaluron. Next slide, please. So what is it that we do when we're lifting the dermis? Well, at Qutis clinics, we do this without surgery. Now, this is obviously a reduced recovery time when compared with surgery. And more people, since the last 2 years, according to the statistics, are choosing dermal fillers rather than plastic surgery. And whilst plastic surgery still has a very valid part to play in the rejuvenation of the face, when people choose to have a less invasive manner of rejuvenating their skin, such as choosing the non-surgical facelift that we at Qutis Clinic offer, it creates a more subtle and 3-dimensional effect rather than a pulled tight surgical approach. So we are looking at all of the different vectors of the face to create a 3-dimensional effect and not just a pulling effect, as so frequently is found in surgery. And I'm very pro-surgery and I'm very pro-dermal filler. And many of our patients indeed have had both plastic surgery and continue to have dermal filler to have a nice rounded and natural look. Next slide, please.
Can I just say at this point, for any late joiners, this is being recorded and we'll share this across with you. So I'll personally email all of you, and any of you who have signed up but only just joined us or haven't been able to join us today, you'll get this email and it will run this recorded video until the end of the weekend. So if you've missed the beginning bit, please don't fret, you can rewatch it.
So thank you, Ange. So how is it that we can treat the face in this way by using a few different types of treatments? And this slide very helpfully points to where we can treat. So if you're thinking, yeah, but how do I know if it will address this issue for me, or how will I know if it addresses that issue for me? You can take some time to look at the slide now, and I can say to you that, for instance, the lines that occur above here, quite often we address with very subtle and very tiny injections of botulinum, which is Botox treatments. Crow's feet, the number 11s that we can get here on frowning, and the forehead lines, which look more horizontal. We can even lift the eyebrow by using a little bit of Botox. And what we do over the years is we just cleverly work with the muscles, that the direction of the muscles, and this can give a more refreshed look. On its own, it can be okay, but when it's combined, Botox with fillers, it addresses the whole of the facial area. And there's not just one area that looks good and one area that looks not so good, if you see what I mean. So as we go further down the face, we can lift the cheeks, and this has a pleasing effect on the side of the mouth when we lift the cheeks, where my fingers are now. And we can lift the sides of the mouth, and we can sharpen the jawline, and including doing other quite neat, small and safe things to the length of the chin or the shape of the nose, or softening under eye dark circles. So if you get a chance, you can have a look at this afterwards, but I think we'll have the next slide, please.
May I ask you a question at this point, Maria?
Sure.
Why would you choose to use both dermal filler and Botox on a patient as opposed to just using Botox on somebody? When would dermal filler be necessary?
It's a great question. So Botox just quietens the muscle, and that's going to be on the next slide and the slide after that. And dermal filler will add some volume. And so it's a placement of a three-dimensional gel just under the skin. So one works on volume replacement and one works on quietening down overactive muscles.
Okay.
Next, so here we see a perfect example. This is a patient of ours, and I think she is about 53. And she came to us due to changes in her circumstances. She wanted to date again. She wanted to have time for herself. All of these things that I know that you're probably thinking, me too, me too. And this is where I think that a nurse-led service provides a really good service for helping people, if you like, get their health and self-esteem back on the road again via appearance-based therapies. It's a very, very worthwhile cause. Next slide, please.
Did this patient have both Botox and filler?
Yes, she did. Yeah.
And why did you choose filler as well as Botox on her, for example? I know this, but it's just to educate our audience, for her frown lines.
Yeah, so if you look underneath her eyes, she has volume loss underneath her eyes. And if you look, we call these marionette lines. And if you look, or pre-jowl sulcus, if we're talking to medics. But if you look here, she has lost volume. The ligaments that hold the structures underneath the skin have started to become stretched and longer, and the whole skin falls. And this is, and tissues fall. And this is part of natural aging process. So what we do is we help all of that going south element by pinning the face back up in a very safe way using dermal fillers. And we relax the muscles in a safe way using Botox.
Excellent, thank you.
So how we use injectables, and then the next slide after that is how we use light and heat. So dermal filler is a smooth injectable gel, as I've already said, and it contains hyaluronic acid, which is found in nature, and it's designed to replace the hyaluronic acid that we have in our own skins and lose. A real interesting little tip here is that we make new hyaluronic acid every 24 hours. And it gets used up and it goes, and we make new every 24 hours. But that space gets to be longer and longer as we get older. So we don't make quite so much or quite so fast. So one patient told me that she had come for her HRT, and I'm thinking, hormone replacement therapy? And she said, no, hyaluronic replacement therapy. So I hope that helps you feel a little bit better. So when we're using dermal fillers, the hyaluronic acid, it does this by filling the space of volume loss, which improves the folds, as well as attracting water to replenish moisture to the skin. So that's interesting. So on the last slide, just go back to the last slide, Angela.
Mm-hmm.
So if you look, you'll see that this lady has got volume loss here at the side of her mouth, and also here, and that starts up here. And after we have finished doing our fairy godmother type magic, you'll see that her skin also looks refreshed. Now, this was only really noticed and observed and reported upon in about the last 10 years, that a curious but advantageous side effect of having dermal fillers is the skin looks a lot more glowy and bright and even spongier. Do that to your cheek. Spongier, a bit of bounce, and more hydrated. Let's go back to the next slide on, Angela.
And the next one?
Yeah, and so once the volume loss, the one before this, Ange.
Beg your pardon.
Yeah, once the volume loss is corrected and improved, instantly there is a result. And then for another month, there is an increasing result that's a little bit more global and looks like you've suddenly got healthier skin with a natural look. And then, of course, the Botox that we use to soften these lines here and these lines around here just relaxes the little muscles that attach to the skin, so that they're not overacting with age. As I say to my patients, you've been going to the gym of life for too long. I'm just going to decrease that a little. Next slide, please, Ange.
Can I just add in one more thing as well, because I get it commonly from patients. We use, so all of our dermal fillers are hyaluronic acid dermal fillers, but we use various different types of dermal fillers, different types being their different thicknesses. So as Maria was just palpating her cheek and sort of showing you a spongy element that you can become familiar with, certain parts of our face are thicker than other parts of our face. So we would use a finer dermal filler that wasn't going to attract so much water. So we wouldn't want swelling, for example, to happen too far after treatment in the tear troughs, compared to that of a dermal filler we would use in the upper cheeks. So softer and firmer dermal fillers that do different things. And the whole point of that is we're not trying to make our patients look false in any way. We want their face to move naturally and look natural. We're just trying to replace lost fat layers and natural hyaluronic acid that sun damage, aging, lifestyle has organically taken away.
Thanks, Ange. This is another question that is frequently asked, is what happens to fillers and Botox over time? Well, Botox works by putting the nerve to sleep over a period of weeks, and then the nerve recovers and the lines reappear. And this always happens. So Botox is used cosmetically and also therapeutically. We use it for migraine headaches, that's therapeutically. We use it for excessive sweating, again, that's therapeutically. We use it to prevent teeth grinding, again, that's therapeutically. And cosmetically within our practice. And also in hospital practices, it is used to prevent cervical dystonias. These are like spastic conditions of the neck, and you may have seen it in older people who are sort of like bent double like this. Botox is used in these great big muscles here to relax and enable them to have a better posture. And we know that you have to come back to have Botox, as indeed do the hospital patients as well. So these nerves always recover. It's just a clever thing that was discovered 35 years ago. Botox was discovered by an ophthalmologist who was using it to prevent this sort of squint where the eyes squint and then eventually can sometimes render the eyes close permanently. So it was first discovered by using here to open the eye up in a condition that we don't deal with. But it was noticed by those patients 30 years ago. "Oh, doc," they said in Canada, "you'll know this, Angela, you're Canadian. I seem to have no wrinkles on this side. Can you use the Botox on the unaffected side, please?" And that's how Botox was discovered. I've met these two doctors. They're called Jean and Alistair Carruthers. Alistair Carruthers is from the UK and Jean is a Canadian. And they are man and wife. The wife is an ophthalmologist and the husband is a dermatologist. And I've spoken to them, and they report that they were chatting one day, evening meal, about their day. And the ophthalmologist, the wife, was chatting and sharing that her patients were asking for Botox on unaffected side so they could look younger. And you can imagine the dermatologist went ping, and the rest is history. What happens to dermal fillers over time? Well, they soften. They're not hard, but they soften even more because they're doing a job, and that's like an architectural job. Once they're in, they're lifting and holding, and they integrate into your own tissue. So I always describe it like a tissue, like the tissue's like a washing cloth or a dishcloth, and then the filler is put on the top of the threads, and then eventually it just winds its way in and integrates to your own tissue. So the hyaluronic acid dermal filler over time will soften, and it does this by exchanging a hyaluronic molecule for tissue fluid molecule, and that's how it softens. And the immune system just metabolizes it over time. Next slide, please. So now we're going on to, we've lifted the face, we've relaxed the face, we've lifted the eyebrow a little bit. What is the role of light, heat, energy treatments that we perform in stage 2 or stage 3 of the Qutis facelift? So generally speaking, patients will be consulted via one of the nurses, and a treatment plan will be drawn up. And this is always in accordance with your treatment goals, which you write down and we keep on our records, and a subsequent consultation that is a medical consultation, and a concordant agreement discussion. And that means that here's what I'm suggesting. Does that fit what you're asking advice on? And then we dovetail that together so that we have a treatment plan that we can agree with. And to get to my point is that that is done in stages, and it would be done, say, week 1, week 4, week 8, week 12, over, if that is the correct treatment plan that one of us decide to put to the patient. And the intense pulse light, the light, heat, energy parts of it comes towards the end part. So we will have lifted your face, but then we may see that you have got some thinning of skin due to sun damage or pigmentation for whatever reason. It could be ethnic skin type origin, or sun damage, or hormonal pigmentation, even red veins. We think of pigmentation as being brown pigmentation and red, which is like veins, so we call vascular pigmentation. And we use intense pulse light for that on the 2nd or 3rd stage of the treatment. And this will also, we can use radio frequency, which is a heat treatment, which will also tighten your skin. So think of the skin as the tablecloth. and we iron it out and clean up the blemishes for the final, if you like, finished look. And we can keep up the light, bright look with regular intense pulse light. We call that IPL. You'll see it on the slide as being called IPL. And we also have medifacials called the hydrofacial, which will also help in terms of taking off dead, dull skin that as we get older, we don't shed so fast. So sometimes having a bit of help with that can help with this overall appearance, which we are calling the Qutis non-surgical facelift. Next slide, please. So why Qutis? Well, we have some of the most experienced and skilled nurse practitioners within the UK. I hate to think about it in these terms, but I have been around a long time. I've been 44 years a nurse, and I've been 25 years as a nurse specialising in medical aesthetics, which is what Botox and cosmetic dermal fillers are called, medical aesthetics. And back 20 years ago, I have written competency frameworks for people who are training, people like doctors and nurses and dentists who are training to come into this. So because I've been around a while and because I'm an academic nurse with a Master of Science degree, this is the type of thing that I gave back to our specialty. And I share it with you because it's nice for you to know we're not a pop-up. We're not somebody who's doing this part-time. This is what we do. We have a team of 16, and I can see that one of our team members is on the seminar today, and she would echo it if she was not on mute. And we're some of the most skilled and specialised nurse practitioners in the country. When we're operating outside of COVID restrictions, we're 6 days a week. That's not to say that we all work 6 days a week, but we are manning 3 clinics across 2 counties 6 days a week. We're very proud of our Google reviews, check those out. And we also, just to make sure that you feel well looked after, we have an out of hours service. You always have the telephone number of the nurse who treated you or my telephone number. And that's out of hours, you know, from 11 o'clock until from 7 o'clock in the morning till 11 o'clock at night. And we do get back to you, you know, even with, I can't remember, did you say it would itch? We will answer that. Or it seems to be more swollen on one side, is that normal? We will get back to you on that. Even right down to, I can't remember, did you say I could have a glass of wine? And we'll get back to you on that one as well. So you've got someone to hold your hand and not a disappearing practitioner. We also have interest-free payment plans which help you spread the cost of your non-surgical facelift over a 10 or a 12-month period. And this is discussed within the confines of your one-to-one consultation, which these days is being done virtually. But afterwards, when we get towards the end, and we're nearly there now, we will be able to help you out by contacting you and booking you in for a virtual consultation with either myself or Angela. Next slide, please. These are photographs. So this is a patient who had a non-surgical facelift, and she had recovered from a very serious illness. And the problem was for her, even though she'd recovered and she was on the way back to being well again, she felt that she wasn't exuding good health. So she came to us, and there's a video in a minute where she speaks about her experience with us. Next slide, please. This is the video. So sit back, I'll have a drink of my tea and listen.
I always wondered, Christine, how you found us and how long it took for you to make the decision, first to look for someone, and then how you found us, and then in order to make the decision, did you wait very long or?
Yeah, I saw your advert a long time ago when you pretty much first opened, and it interested me. At the time, I didn't know anybody that had ever had any treatments, and it wasn't something that I was desperate for at the time. But over time, through weight loss, health issues, I had a substantial weight loss.
In your face?
In my face,
Yeah.
everywhere, but it really showed in my face, and I looked awful.
Yeah.
So I did some research, and stupidly, because it was Whitney and I lived in Whitney, and I didn't want to suddenly appear looking differently,
Yeah.
I went somewhere else, and it was okay, but not what I wanted or needed. And so it took another couple of years then, and further loss of volume, until I eventually came to you and wished that I'd come to you years ago. When I first saw your advert, because it was exactly what I needed. It was obvious that I wouldn't go to the beauty salon or the treatments that you carried out on me.
Did you feel at any time sold to, or under any heavy pressure? I mean,
no, I came for my consultation, and we went through it, and it was great, and I was reassured. But on the day, I was still, wary, scared. Excuse me. Because it is fear of the unknown. I don't know anybody that's had anything like this done.
And what exactly did you have done? What was it called?
It's a non-surgical facelift.
Yes.
And I don't know anybody that I could talk to, because I haven't got a wide range of people that I do speak to or friends, and the people don't tend to talk about it.
Not in this country, they
No,
don't.
and it's ridiculous, because we need to talk about it. We need people to know that if you're feeling like I did, or even half as bad as I did, that there's an answer, and you're not going to come out looking like a puffy hamster.
Yes.
Which was a big fear.
Yes.
Your natural best, it is exactly it. And all I wanted was, when somebody said to me, "Oh, you look well today," I wanted to believe it.
Yes.
Because people say that to you when they know the situation.
Yeah. Yeah.
And it doesn't help.
Do you have any other treatments that Qutis offer besides the dermal fillers?
Yes, hydrofacials.
Yeah.
And I've had the skin tightening and collagen pin, which fabulous results.
Yes.
Obviously, with the collagen pin, you're a bit pink for a couple of days,
yes.
so you need to take that into consideration. But the hydrofacial, no, you can just walk out and feel, wow.
Yeah, it is about a whole package, isn't it? Even what you do to yourself at home.
Absolutely.
With clinical products.
And the products.
Yeah.
Because again, you didn't push those on me. A lot of places do. You didn't at all. I had to ask about them, and the best, absolutely the best I've ever used.
Yeah. And this is really why you asked me if you could do this, so that you could help other people like yourself. Not really helping Qutis, but helping other people to get rid of the concerns, etc., and just take that.
I want other people to not walk around like I did for so long. As we get older, it's typical, isn't it, that we start to feel invisible,
yes.
etc.
Yeah.
Well, I just felt worse than invisible, and it was life-changing for me, and like I said to you, actually life-saving.
No, it's lovely to know. What type of things were you able to do after you had renewed confidence from your non-surgical facelift? What things did you do that you stopped doing?
Walk around with my head held up rather than look at palm. It's nothing, majorly dramatic. It's just feeling normal.
Yeah.
And comfortable.
Yeah. Did you do anything else, like book any holidays or?
I did go on holiday.
Yeah.
On my own, and actually I took my first ever selfie and I sent it to you.
You did, and that was fantastic to receive that. We loved it, all the staff loved it. You look great.
I did, and you know, although I said myself, yeah, I mean, I walked around the pool and felt great.
Yes.
In my body and my face.
Yes. And since then, you've had some little important life events, like the marriage of your son, etc. And you probably decided to get a few treatments before the wedding.
The photos the month before.
Yeah.
And my facials do regularly. And didn't wear my glasses. And I had a lot of confidence.
Great.
A lot.
Great. And I mean, the thing is, it's so marvellous to see you sitting here today. If I look back to 2 or 3 years ago when we first met, you are a changed woman. And this is one of the reasons why I will never retire, because I just love the work that we do and getting back together with you.
Don't retire, you can't. I need you, so does everybody else.
Yeah.
Seriously, you know, for anybody that's watching this or wondering, just do it.
Yeah.
Just do it, please.
Ah, lovely, Christine. You can see why those of us who've been in medical aesthetics for a number of years, that's Angela and myself, and Paula Shurrock, who works with us in the Tame Clinic, it becomes very much like a passion. It's an overused word, but we understand that we are still nursing, and we're nursing self-esteems back to good health, is what I like to say. And it suits the nursing discipline very well. You know, the ability to be a professional, to listen, to prescribe where it's important, because, you know, some of these things are a medical prescription like Botox. But it suits nursing and the element of nurses very well to get involved with this. And we have some lovely patients that we have wonderful relationships with. And the next few slides that are coming up are some of those patients who've allowed us to use their images, and we're getting very close to questions. So Angela, I think we'll zip through the before and after photographs now.
So I'll just keep going.
Yeah, keep going. You'll see the effect it has on the jawline of this lady and how she's lifted by the side view, particularly. You can see that she still looks herself.
With chin.
Yeah. And this lady looks positive, more positive, more happy, and it's still her, but definitely improved. She was very much over the moon, was this lady.
And I'd like to add at this point, these photographs, all three actually are directly after treatment. So the photos that you see on the left-hand side of these two pairs, the lighting's slightly different because the original photo was taken with a different phone, and then the final photo was taken with a different phone again. But the photo on the right is pre and post treatment on the same day, to just give you an idea of how you would look directly after treatment. Both of these are directly after treatment.
So, yeah. This is someone who's been having a little bit and often. She has been coming to us for about 10 years, and she has a little bit and often. And I would say that this, the one on the right with the black background, there's differences 10 years from when she first started coming to now. And I think she looks younger on the right-hand side one.
Yeah.
This is someone who went the whole hog. She had her nose as well as her chin brought forward because she had retrognathia, which is a chin that tilts backwards. So that's often treated by facial-maxillary surgeons under general anaesthetic, but many people don't have the stomach for that, don't want to do it. So we can do a very good job with dermal fillers to help give a look that is more imbalanced.
Maria, can you tell us how long these results will last, these patients?
Yeah, so from 9 to 12 months, and then top-ups may not be quite as many, if you like, much of an outlay of expense is the first time.
And what's a good way to avoid another huge top-up for example, would keeping...
Taking advice from your nurse practitioner and come and have a little and often, every 6 months. Generally speaking, people want to get to a level and then maintain it. So they may maintain it with a very small outlay every 6 months, or they may come back every year.
Okay.
Now, the last patient was jaw, and this patient is under eyes, and the next one is lips, and she's a younger patient, mainly just lips. All of these photographs are on our website that you can look at later. And here is somebody, one of the earlier non-surgical facelift, and the background of this patient is she was a triathlete, so she ran all her facial fat off her really. She was a very lean professional woman, and felt that she not only was looking haggard and drawn within her face, but she felt she was looking masculine, because she was developing a runner's body and a runner's face. So we were able, she's still a runner, and she's still fit, but she has a little bit of dermal filler to help her not look drawn. And now it's time for questions.
So bear with me now. Okay, I'm going to read the questions out, and then Maria, I'll let you answer them, and if I can chime in at any point, I will. So the first question is there an allergy test done before Botox and dermal fillers?
There is no allergy test done before Botox or dermal fillers, because there have been from 0 to extremely few results done. Results for allergy. There have been no allergic reactions. Certainly in my 25 years of practice, I haven't seen an allergic reaction to dermal filler or to Botox. Sometimes people can react to the local anesthetic that's combined within the dermal filler, or they can respond to the numbing cream, which we don't always use, we sometimes use. This normally resolves itself. It's never anything very serious, mainly redness when I've seen a reaction to a cream. But basically the answer is no, we don't do testing. Years ago, when we used the collagen filler, which was taken from cattle hide, we would do a patch test on the arm and wait 28 days. But that's because there was an animal protein being used, and 3 in 100 people would go on to be allergic to collagen. But I've been using hyaluronic acid fillers for about 21 years now, and I have never seen a reaction. And furthermore, there are very few reactions within the medical literature that I read very frequently.
You mentioned animal product. Is dermal filler and Botox suitable for vegans?
Yes, they're both with Botox. That is a organism found in nature, and it's copied and changed, etc., within the lab. And with dermal filler, as I've already explained, that's found in your skin, and it is synthesized in a lab to mimic the exact genetic makeup of that molecule.
Okay. Next question. Is it reversible? What if I don't like the results?
So dermal filler is reversible, yes. Botox will wear off over a 7 to 12 week period. Generally speaking, people will need to have their Botox redone every 12 to 16 weeks. And as we serially and progressively weaken those muscles with serial treatments, people sometimes just have Botox twice a year. So that's not reversible, but it does wear off. Dermal fillers are reversible, and we can use a reversing medicine called hyalase, which is a dissolving enzyme, and that is patch tested for before we use that, but it works almost instantly, and it can be done a week or so after treatment.
I would like to add to this that we very rarely, if ever, have to reverse our treatments. I can't recall ever having to reverse any of my treatments. So I can say hand on heart, and I don't think Maria ever has actually. It's more about correction from other practitioners or non-medical qualified practitioners that we will sometimes on occasion reverse to then try and redo. But it's one of the reasons we stage our non-surgical facelift plans, because it's always so much simpler and easier to add in product, of course, than it is to take away. So it's about getting the dermis used to the results, letting the face settle, and letting you as a patient getting used to the results and seeing the final result before we go on to the next stage. So it's a journey that we do together. Next question. Hi, this is a wonderful session. Thank you for saying that. I have a question re RF. So I'm assuming this is radio frequency. And it says, is it true that it reduces fat when used on the face?
No, I haven't read anything within the scientific literature that evidences that. Neither has it been my experience, no, because it works on the skin, not the fat.
I think potentially there could be a misunderstanding with the question or the theory. So it's not necessarily radio frequency. There is a technology out there that works on a layer called the SMAS, which is deeper down. And if that's misused or overused, that can have a negative effect. We actually don't use the technology within Qutis clinics. And the technology is called, Maria, can you remind me? There's two different names for it.
HIFU or alt therapy.
Alt therapy, yeah.
And the person who asked that question, does that answer you? You might want to just add a comment if we've answered it enough for you.
Yeah. If any of the questions that I'm reading out aren't clear, good point, Maria, please just type in and add. So the next question I have here, we sort of already addressed it, but they're saying, what type of dermal filler do you use? And is it different on different areas of the face?
Yeah, the answer is yes, it's different on different areas of the face, and it's all down to the molecular size. And of course, we're trained on which area should get which filler. And we use several different types of fillers. We use Teoxane, Teosal, we use Mertz, Bellatiro, we have used Juvederm, Allergan's Juvederm in the past. We have used Restylane. We have used Sculptra. We tend to keep with things that have got the lowest side effect profile in our hands.
Excellent, thank you. And the final question is, what happens from here? How can I book my consultation? Do you want me to take this one? Shall I? So we offer virtual consultations, as Maria said, and one of our thank yous to you for joining us today is to offer you a free virtual consultation. We typically would ask a £50 deposit, which is refundable against treatment, but in this situation, we're not asking that. All you have to do is respond to an email that I will send you, and that email will come to you by the end of day tomorrow at the latest. And it will have a copy of this video, this session today, as well as instructions as to how you can book, which will just be very informally through myself. We'll be offering virtual consultations on a Wednesday morning. However, there is flexibility if your diary doesn't accommodate a Wednesday morning very well. I have one more question that's just popped up, and I'll just read it out, and then I think we'll say goodbye to everybody. So thank you for your answer. So if I understand correct, only HIFU and alt therapy might affect the SMAS. Other HF treatments are okay to be used on the face, ?
Yes, other radiofrequency treatments are okay to be used on the face. Naturally speaking, when you're coming to my practice, our practice, I like to be the one that authorizes that you're able to have that. We are still looking at the tablecloth that is the skin with the radiofrequency treatment. We're tightening areas, and it's not deep tightening, it's shallow tightening, and it's on the skin. The collagen fibers of the skin are stimulated to make more, which has an all-round tighter effect. it is just for the superficial skin, the radiotherapy, the radiofrequency treatment that we use.
Excellent. Okay. Thank you very much. Thanks everybody for joining us. Maria, thank you for your expertise and time today. We'll say goodbye, and as promised, you'll receive this video and a recording over the next day or two. Thank you again.
Thank you.
Thank you.